My name is Claude, and today we are talking about the Canadian healthcare system. This is a project that is supported by the Maranatha African Mission. So the overview of the presentation today, we'll be looking at the Canada Health Act, understanding how the Canadian healthcare system works, some barriers that people may encounter while accessing healthcare. And because we are in the pandemic, we have to look at how COVID-19 have impacted access to healthcare services. So the Canadian healthcare system works, it's a universal program. And so it follows a constitution, and this one is known as the Canada Health Act. So the Canada Health Act is an act that relates to cash contributions that the federal government makes to provincial and territorial government. And within this Canada Health Act, conditions and criteria are set out for um, how the money is given to the provincial and territorial government on what they have to meet in order to receive the funding. Um, so the Canada Health Care Act, it operates under 5 principles. And these are mainly public administration, comprehensiveness, universality, accessibility, and portability. So with public administration, it means that all services under the healthcare system have to be governed or carried on a non-profit basis by both the territorial or provincial government. And comprehensiveness, it means all medically necessary services provided by the hospitals or medical practitioners must be insured by provincial and territorial government. And universality just tells us that all persons who are in Canada or living in Canada or having seeking healthcare services, um, they have they're covered by the provincial and territorial government. But this excludes certain populations such as illegal immigrants, uh, international people visiting the country. Those are excluded, but all persons who are insured within a province or territory in Canada must have access to all medically necessary services. And then accessibility means that all insured persons within a province or a territory must be provided with reasonable access to medically necessary hospital and physician services without financial barriers. So if you need something and if you need to see a doctor and you don't have money, as long as you're a resident of a province or territory and you are insured, you must be covered. You must be able to see the doctor without um, having to pay. And portability means that if a resident of BC, for example, is moving to Alberta or Ontario or Quebec, um, the province should still be able to cover the person. The person should still be able to access healthcare services wherever they might be within Canada. Now, some provinces will provide some coverage out of country, but that changes or varies between provinces and territories. So we're going to look at some of the key definitions that go along with the healthcare system. So you've got extended healthcare services, and these are services provided to residents of a province, and they include nursing home, intermediate care services, adult residential care service, home care service, and ambulatory healthcare services. And the coverage from the healthcare system extends to these extended healthcare services. And then hospital services are services provided to inpatients and outpatients at a hospital. and the services are medically necessary for the purpose of maintaining health, preventing disease, or diagnosing or treating an injury, an illness, or a disability. And they also include nursing services, laboratory, radiological, and other diagnostic procedures, drug administrations, medical and surgical supply use, accommodation and meals while in the hospital or in a care home or long-term care facility, and use of operating rooms, and so on. And physician services are medically necessary services rendered by medical practitioners. So any services you get from a doctor. Um, so I mentioned how the federal government gives or funds the both provincial and territorial government. So we'll look on the role of each level of government and how it works within healthcare. So in Canada, we have the federal government, like the one that's based in Ottawa, the main government. And then you have provincial and territorial government. So then you go to each province and each territory. They each have their own government. So for the federal government, they set out and administer on national principles for the system under the Canada Health Act. So the funding that the federal government makes to provincial and territorial government follows the Canada Health Act. And within Canada Health Act, we know that the province must meet all the five principles in order to receive funding from the government. The federal government also provides financial support to provinces and territories, and also deliver primary care and supplementary services to groups such as the First Nations, Canadian Armed Forces, veterans, and inmates in federal prisons, refugees, claimants, and so on. Then the provincial and territorial government. So each province or territory, they will administer health insurance plans to their residents. So if you're a resident of BC, you have a medical service plan, which is a form of insurance for BC residents. And then each province will also plan and fund care in hospitals and other healthcare facilities. They will also cover services provided by doctors and other health professionals. They also plan and implement health promotion and public health initiatives and negotiate fees with healthcare professionals. Now, all these provincial and territorial roles, some require funding from the provincial government, from the federal government, as long as they meet the five principles of the Canada Health Act. Now we'll talk about barriers to accessing healthcare services by seniors. Now, now these barriers can be faced by any age group. It doesn't have to be just seniors. Some of the barriers include communication dynamics and sharing of health information in relation to power dynamics. So as a patient and doctor, there's that power imbalance in between, one being superior and the other being inferior in that kind of way. So communication becomes very integral in terms of like sharing your own health information and getting the care that you need from the doctor or healthcare professional. There are some stereotypical concepts on different population groups, such as Aboriginals and immigrants. Aboriginals and immigrants, there is some concept of stereotypes, or this population is known to do drugs, or this population is known to do this kind of behavior requiring more medical attention. So with that stereotypes, people are reluctant to seek healthcare services. There's also a lack of cultural safe practice. For some tribes or some ethnicities, A female patient would prefer to have a female health professional, but in some cases that's not viable, and so that can also be a barrier in accessing healthcare. Some people require um, surgeries or procedures or diagnostics outside of their local hostels or um, care facilities and have to go to a different province or another city within the province. And so the traveling expenses become a burden. Transportation and accommodation all become a burden, and finances can become a burden. Um, the need to take some time away from work to support oneself or family member, say you or your family member gets sick, need to be admitted to the hospital or need to be looked after, and you can only be the one looking after him or her or they, then you might need to take some time away from work, which will become a burden in terms of like finances, being able to finance your bills, and taking care of some of your own needs. And paying out of pocket money for care can be very complicated as there are some services that are not covered under the provincial and territorial coverage. So you have to pay some of your own money for these kind of things, and it can be costly. And then unfortunately, some healthcare professionals can be unreliable, hence unable to meet your needs as a patient. Um, and the complexity of navigating the healthcare system. There's this whole system that's been set up. So knowing where to go, what to do, the resources that are out there for you, and not knowing those can also be a barrier. And so I mentioned how some of um, the procedures or diagnostics or services may not be covered by the healthcare system here in Canada, and some of them include prescription drugs. So if you go to the hospital and you are cared for by your nurse, and then your doctor discharges you home, and they prescribe you medications that you have to take at home. These medications that the doctors prescribe to you, they're not covered under the healthcare system. So when you go home, you have to go to the pharmacy and buy those medications from your own pocket. And some medications can be really expensive. Dental costs, so dentist is not covered. Ambulance services, they're not covered. If you want a private hospital rooms, they are also not covered. Prescription glasses, if your vision is limited for some reasons and need one, that's not covered. Hearing aids, if you're hard of hearing or have some disability there, and cosmetic surgeries as well, they are not covered under the healthcare system. Now, you may ask, how can someone get some coverage from this? Some people have employment insurance. So if you are hired by an employer who has some form of benefit, you can have coverage for some of these services. But for some who do not have that employment coverage or their own money to have an private insurance, these costs cannot be covered and hence can be a burden if one needs them. So with those services not being covered by the healthcare system, you can buy your own private health insurance from insurance company, and you can get the dental, vision care cover, the outpatient prescription drugs, rehabilitation services, and private hospital rooms covered. Some individuals will choose to get private health insurance coverage from their employers, as I mentioned, or unions or other organizations through a group contract insurance. Most provinces have public prescription drug coverage for different population demographics. For example, seniors aged 65 and over, those who are on social assistance, and children and youth. And coverage of services under dental services, physiotherapy, psychologist visits, chiropractic care, and cosmetic or plastic surgery vary from province to province. So with all those services I've mentioned, you will find that one province might cover this, the other might not, and or not even one at all. Um, and then so long-term care and social support. So long-term care and social supports are funded through general taxation, and coverage varies across jurisdiction. So when you go, like every time you get paid from your employer, the government deducts tax money, and that's how most of these services are funded. Home and residential long-term care service eligibility is based on a needs-based assessment relating to health status and functionality. Assuming if you've gotten old, or if you you're not able to do certain things that you're supposed to be doing on your own, your level of functionality has decreased. Um, that's how they determine. That's what needs-based assessment um, is. Public funding of home care is the responsibility of provincial and territorial government through contract agencies. So like in BC, the support of independent living program allows clients to purchase their own home support services. Provinces and territories are responsible for providing palliative and end-of-life care in hospitals, and some services coverage may extend beyond the hospital setting for palliative and end-of-life care. We'll talk more on palliative and end-of-life care in our next presentation. Okay, here I just have 4 tips on how one can better access healthcare services. There's more tips. This is just what I could think of. So to avoid those barriers or try to access healthcare needs, you want to build rapport with your healthcare provider. You want to establish an open communication with your healthcare provider where your communication is open and there are no um, like no information is left out. So you are developing trust and ensure your healthcare provider is aware of your health issues and concerns. Like you're not withholding information that is necessary for the healthcare provider to make a diagnostic or to better provide care for you, to better meet your needs in that case. I also, unless otherwise, you should avoid having multiple providers unless you really need to, unless if your conditions dictate that you need to see some like different specialists, different healthcare members, because one disease or one illness might require you to see 3, 4 different healthcare professionals. Unless that's the case, you should stick to one doctor. Now, with COVID around us, between us, we have to look at how it has affected healthcare services. So we know that with COVID-19, there was a lot of unemployment for a lot of people. So people who probably had employer-based insurance, they lost those insurance coverage. So which means they would not, um, in that time, they would not access those services that are not funded under the Canada Health Act or under the Canadian healthcare system. The increased surge in COVID-19 cases resulting in cancellation of planned or necessary medical and surgical procedures, which further delayed treatment. Where I work at the hospital, they had to uh, they had to cancel a lot of surgeries just to make rooms for COVID patients. So now these people who needed those surgeries, they were delayed, which would have affected their health and delayed their treatment plan. And then access to standard care becomes difficult because of the burden created by the pandemic. Shortage of beds, shortage of nurses, shortage of healthcare staff. So there's not enough staff or supplies to better perform care in a hospital or long-term care setting. Overflow of patients in hospital setting resulting in supply shortages, I had mentioned, putting both the patient and healthcare providers at risk for infection. And that concludes our Canadian healthcare system PowerPoint. Hi there, my name is Claude, and today we are continuing our presentations. And today's topic is about palliative care in Canada. This project is supported by the Maranatha African Mission. So in this PowerPoint, we'll look on palliative care. We will focus on palliative care and hospice care, looking at the difference. We'll look at the goals of palliative care and what it intends. And then we'll look at barriers to accessing palliative care and talk a little bit about death and what that means. So according to the World Health Organization, palliative care is an approach that improves the quality of life of patients, that includes adults and children, and their families who are facing problems associated with life-threatening illnesses. Furthermore, palliative care prevents and relieves suffering through the early identification, correct assessment, and treatment of pain and other problems, whether physical, psychosocial, or spiritual. Hospice care, on the other hand, it is a kind of care that focuses on the quality of life for people and their caregivers who are experiencing life-limiting illness. Hospice care provides compassionate care for people in their last stages of incurable disease so that they may live as fully comfortable as possible. And generally, hospice care should be used when a person is expected to live less than 6 months. Whereas palliative care can be used or can be performed at any stage of the disease process. Let's look at the difference between hospice care and palliative care. So palliative care can be offered and provided at any stage of a serious illness, as I had mentioned. Hospice care, on the other hand, is offered and provided to patients in their last stage of an incurable disease during the last 6 months of their lifetime on Earth. Palliative care can be provided while the patient is still receiving active treatment. And hospice care is provided when there is no active or curative treatment being given for the serious illness. At this point, for hospice care, treatment focuses on managing symptoms and side effects. Those are the two main differences between palliative care and hospice care. Now, what is the focus of palliative care? Well, palliative care focuses on managing pain and symptom, looking at the psychosocial care of the patient and the psychosocial care of the family as well. Palliative care looks at spiritual care of the patient, determining what needs are they religious, or do they have some form of spiritual needs that need to be taken care of during that time frame. Palliative care also focuses on disease management, preparing for and managing dying, and bereavement. Bereavement is the period of that follows after death. And the goals of palliative care are to provide relief from pain and other distressing symptoms associated with the illness, to offer support system that allows the patient to live as actively as possible until death. So you want to make sure that the patient is as comfortable as possible and still participating in what they can accomplish within their functionality level until death. The other goal of palliative care is to offer a support system that helps the family cope during the patient's illness journey and during the period of bereavement, so the period after death. Palliative care does not intend to hasten nor postpone death. Palliative care seeks to integrate the patient's psychological and spiritual aspects, needs, and the barriers to palliative care encompasses spiritual beliefs. One might have some beliefs. One's beliefs may not correspond or may not be congruent with what palliative care is offering. Lack of not having enough information or resources or knowing about the services available for palliative care can also be a barrier. Some cultural beliefs, different cultures view death and palliative care differently, so the beliefs will determine if palliative care can be offered. There's a fear of cost or finances for palliative care. So not knowing those resources, there are some resources out there on how one can be supported for palliative care. So knowing the resources and not having to fear about the cost of finances about healthcare, about palliative care. Lack of advocacy support from one's healthcare provider can also be a barrier. So if there's no advocacy or enough support from your healthcare provider, it can also be a barrier to accessing or to be able to have palliative care. Differences in family members, their views, their beliefs, can also be a barrier to accessing palliative care. Now, the benefits of palliative care to the family as well as the patient. It offers support system and helps the family navigate life during this difficult moment. Palliative care also helps the family understand the different choices available for care for their loved ones. It also improves the patient's everyday life and in turn reduces the family concerns. Palliative care brings awareness of where the patient is at in terms of like their health status, what they should expect. And once that's all known, it reduces the concern that the family may have in regards to their loved ones. Now, death is one of the conversations that people don't usually talk about, but it does. Talking about death has its own benefits. Some of them include, because once you know that death is going to happen to everybody, no matter what, however long you're going to live on earth, one day you're going to die. So understanding and knowing that death is the end to all our lives, it reduces death-related anxiety. It increases acceptance of mortality because some people deny mortality, surprisingly. Um, it increases the knowledge, uh, increases documentation and stability of end-of-life wishes. So if you know, like once you know, or once you talk about death, you can plan ahead on your wishes and how you wish to have um, your fortune to be distributed to your family members. It increases engagement with palliative services. It decreases hospitalization. Death compensations also increase engagement with health promotion interventions. And that's conclude our presentation on palliative care in Canada. Thank you for your time.